Great. Well, welcome to the webinar hosted by the National Healthy Nail and Beauty Salon Alliance. Founded in 2007, the National Healthy Nail and Beauty Salon Alliance is a national network comprised of more than 30 groups and individuals and is led by the California Healthy Nail Salon Collaborative and Women's Voices for the Earth. The Alliance connects advocates, salon workers, and organizations from across the country to advance worker health and safety through collaborative projects, these membership calls, and webinars, and policy advocacy efforts. And today's membership call is on the effectiveness of local exhaust ventilation systems. And we're very lucky to have Dr. Martin Cohen from the University of Washington's Department of Occupational and Environmental Health Sciences on the call today. And he will be presenting a study that evaluated local exhaust systems that was conducted in conjunction with the local hazardous waste management program in King County, Washington. The study evaluated 4 local exhaust ventilation systems to determine their effectiveness at eliminating vapors and dust from the breathing zones of nail salon technicians and their clients. So this webinar will present the methods, results, and conclusions of their work. As I mentioned earlier, after the presentation, the lines will be unmuted, and I think we'll have about 15 minutes or so for questions. So Marty, did you want to get started?
Sure. Can you hear me all right?
Everyone's muted, so they can't respond.
Well, I was asking you, actually. But,
yeah, I can hear you great. And if folks are having problems with the audio, you can just chat us in the chat box.
Okay. So thank you for joining us here this morning. And I guess I need to, in full disclosure, this is the first time I've done a webinar, and it is very odd because I'm sitting in my office, my closed office, and I am just going to give a presentation without any input from an audience, which is odd for a presenter because I enjoy the interaction between the audience and myself. So it's a loss, but I think it'll be good information imparted to you guys, hopefully. So let me just start out. So here's the controls. So we did this study, actually a master's student, Nazila Shakibai, who's a master's student with us in our department, did a study last year looking at local exhaust ventilation systems and how effectively they can be used to reduce workers' exposures to vapors and dust in nail salons. Currently, she's working with the State Department of Labor and Industries, the DOSH program there, the state OSHA program. We also had input from Mike Yost and Jerry Croteau from our departments. And as noted before, Lori Foster with the local hazardous waste management program in King County, Washington, had a lot of input as well as funded the study. That being said, just give you an overview of what I'm going to speak about, go over some of the background material about what we did and why we did it, detailing the methods of what we did, show you some photos of the methods, and then present results and draw some conclusions as to what we found and where future should go. Okay, so you guys know this more than I think, that about 200,000 salons, nail salons, are in the U.S. with about 375,000 employees. And this employees is an interesting fact, and I'll bring that up in a sec. But the people working there are mainly females, 96%, 63% minority workers, and obviously in some locales it's going to differ from others. And nationwide, about 35 to 40% of these folks are Vietnamese. 70% are self-employed, and that goes back to that 375,000 employees. Most of these workers are self-employed, and what that means from the health and safety perspective is that OSHA doesn't really have much impact with them. OSHA can't really inspect a work site where there's just a self-employed person. And if the nail salon is basically having renting out, leasing the booths or the tables, then OSHA can't really have an impact there. They can only inspect if there's an employee, one employee or more. So in some states, there may be a threshold in other states of 10. So it's difficult for OSHA to get involved here. So some of the services that are frequently done in these facilities, as you all know, manicure and pedicure, polish changes, acrylic nails, gel nails, things like that are the frequent services that are conducted. And these types of services have different types of potential contaminants associated with them. And some of the things that we see, the chemicals that we see being used, acetone, various alcohols, butyl acetate, different plasticizers like phthalates, the ethyl methacrylate, those are plasticizers. Then we have formaldehyde and toluene. These chemicals have this whole list may or may not be used in individual salons, but historically these have been used. Some of the materials like formaldehyde, methyl methacrylate, and toluene are trying to be removed from the products in the salons. Sometimes they are found in the salons, though. And sometimes we exchange various products with others that may not be, that may be a little better, but not necessarily great. Like ethyl methacrylate has been used instead of methyl methacrylate. It's slightly less health impacting, but still it's not great material. So those are some of the chemicals that we find in salons. Then other concerns would be dust from grinding the nails, as well as potentially nail fungus. So when we designed our study, we went about looking at not only the chemicals being used, and actually you guys can't see my gesticulations here, so it removes a layer of the visuals. I am gesticulating and pointing to things, but you guys can't see that. Sorry about that. So we not only have the chemicals, but we have dust. So we decided to look at acetone as a sort of a sentinel chemical and just total dust from grinding nails as to our focus for the study. So the reason why we got involved with this is that we were contacted by Lori Foster with King County to ask us if we could help out evaluate systems for reducing potential exposures to the nail technicians as well as their clients, because they were reporting health impacts as well as irritation from the materials that were generated during these different processes. We got a student involved, Nazila, and she did a great job of this. But what we did was evaluate the systems in multiple ways. And firstly, we evaluated them for their physical characteristics. We measured the flow rates. Actually, let me step back. Lori spoke to a bunch of different suppliers of local exhaust ventilation systems and was able to get 4 of them to supply systems for our evaluation. And that was a great number for us to evaluate. So we looked at these 4 systems, and I'll show you a photo of them in a little while. Actually, next slide. But what we did is we evaluated their flow rate, which is the volume of air each system is bringing into its nozzle, the capture velocity, which is the velocity of the air that's generated at the point of generation of the contaminant. So say if you have a nozzle about 5 inches away from the hand, well, we're interested in the velocity of air at the person's hand because that's where the contaminants are generated. So we measure the velocity there, and that's called the capture velocity. We also measured the face velocity, which is the velocity of the air that's entering the system right at the face of the inlet. And then we also measured the noise level. And for that, we placed the systems in a quiet room and measured the noise level that was at the worker's ear in their hearing zone. So those are some of the characteristics that we quantified. Then we jumped into measuring the effectiveness of these systems at reducing the contaminants specifically. And we did that for particles or dust as well as the solvents. We did separate experiments for that. And then lastly, we evaluate the system's overall efficiency. This was more of a sort of an exercise because jumping back, this measurement, the LEV system's contaminant reduction, this is really of what's important. Okay, this is how effective the system is going to be in a nail salon. we evaluated the system's overall efficiency because it would give us a sense of how much air is flowing into the system and the efficiency of the charcoal beds to remove the contaminants, and how much fresh air is it delivering to the room. I'll get into the details on that later. Okay, so these are what the systems look like, the 4 systems. You can see that they're generally, well, in my eyes, they're very similar looking. There's a box and a nozzle and an inlet. They're all electrically operated. There's a fan in each one of these with charcoal media as well as filter media to remove dust. We've got the hose, the nozzle, and then some type of inlet. They all have different levels of, I guess, engineering finesse. Some of them were meant for industrial settings and repurposed for nail salons, and some were specifically designed for nail salons. Some of them had more engineered inlets, like here was a sort of a bell cone. This was a hemispherical inlet. This is a rectangular inlet, and this is just a round inlet that you could adjust. So there's the systems. Here's what the anatomy of one of them generically looks like. We've got the inlet here. Imagine a hose coming out of here. The air comes in through here. There's a pre-filter here, which captures the big particles, and then a HEPA filter, a high-efficiency particle filter back here, and then a charcoal bed or some other type of sorbent that captures the solvents, and then a blower or fan that moves the air, that sucks the air through here, and the clean air is exhausted either through a vent or through the case of the system. Here's the label of independent contractor. Sorry about that. I was looking at a question. I should just focus on the slides here. So that's generally how the system works. The pre-filters are really in place to keep the HEPA filter clean, because the HEPA filters are very expensive, and the longer you can allow it to run, the less running cost it'll be. The activated charcoal bed also has a capacity that needs to be evaluated. This is something that we didn't do, but it can only absorb a certain amount of vapors, okay, a certain amount of acetone or isopropyl alcohol or whatever before the sites become saturated and it doesn't work as well anymore or at all. That's one of the issues with this type of system, and that's something that we weren't able to evaluate. Okay, to give you a sense of the methods that we used, when we were looking at the flow measurements and the capture velocity, we set up a system like this, where here's one of the inlets, and we set up some graph paper here and marked out some points, and we measured the velocity of air flowing into the tube, into the inlet, at different locations. And basically, we're able to describe a surface of airflow into the inlet. And then what we did to measure the flow rate, because it was difficult we didn't want to drill a hole into the inlet, into the hose, because they weren't really ours. So we added a little trunk here, and then measured the velocity in here, and and the cross-sectional area, and we're able to calculate the flow rate into the system. And we were able to compare that to what the manufacturer's specs were. And then noise, I guess I alluded to that already, where we were measuring the noise level at the worker's hearing zone in a quiet room. Okay. Now moving on to the dust capture efficiency. What we did here is to have a couple scenario, and that was grinding acrylic nails. You can see it here, and let's see. And what we did is we used a standard Salon tool, procedures, and typical position and duration to take our measurements. I'll show you a closer photo here. Let's see, come on, what's going on here? Okay, here we have a close-up photo of the actual work being done. this is our nail technician. This is Mark. We trained him up to be able to do the work. He did a very good job. But you can see he's grinding on these nails, these fake nails. Nazila had, we had gotten a bunch of fake nails, and she had put on some acrylic to them and colored acrylic to allow us to see us removing it. It was easier to see the removal process. And Mark would grind on each nail for a prescribed period of time, I think about 30 seconds, and then move on to the next nail. You can see that we used, these are called mandrels. Let's jump back a sec, one slide. These are basically porcelain hands that the glove industry uses to dip into a rubber or latex solution and pull it out, and then voila, you have a glove. Well, we bought these on eBay actually to use as our hands, and you can see that we had them palms up and have the nails on the inside of the fingers, because if you had it in normal position, the fingers were way too high for typical procedures. So we had them palms up, a prescribed distance from the inlet. You can't see it very well, but here's the inlet for the ventilation system, and he's working on the nails. So we measured dust concentrations in real time with an instrument called a thermoelectron CADR 1500, and it was giving us dust measurements once a second, and we're logging it into an onboard computer. Again, we're measuring the breathing zone. I'll show you the tubes again. And then what we did is we did the same experiments with and without the local exhaust ventilation systems, and then we compared them to calculate our capture efficiency. Here's the equation that we used. So we calculated a no control NC concentration. So that was the concentration without controls. Subtracted off the concentration measured with the local exhaust ventilation system, and we did this for each one. Multiplied times 100, and then divided by the concentration with no control. And that would give us the percent capture efficiency. So say if we had 100 micrograms per cubic meter, that's how we're measuring dust. Without control, we measured 50 micrograms per cubic meter with the local exhaust ventilation, and this is 100 as well. We'd come up with a 50% capture efficiency. That's how we're using this measure. Okay, this is a close-up here. You can see here's the inlet for, I'm not sure which one's dust and which one's solvent. Let's see. And actually over here, you can see this is the dust. This is the instrument we use to measure the dust. Okay, now shifting gears a little, measuring the acetone capture efficiency. We used two different scenarios here. We looked at removing polish and removing nails, two different procedures. To remove the polish, we had Mark wipe each nail with an acetone saturated cotton ball. And he wiped each nail for a few seconds. I can't remember the exact duration. And then moved on to the next nail, and after the first hand, he moved the hand over and took the second hand over and used a new cotton ball and wiped those nails. Again, with and without the local exhaust ventilation. And here you can see, here's one of the local exhaust ventilation systems in place. Here we were measuring the solvents for the acetone with an RAE 2000 PID, photoionization detector. And this measures solvents in real time. And again, we were logging those data once a second, so we can see the concentrations, how they change quickly. Again, similar to the dust, we're measuring in the breathing zone with and without the LEVs in place, and then also using the same equation to measure the capture efficiency. I should note that if you were to drive by our office down the main street here, you'd be able to look into our window and see 4 sets of these porcelain hands waving at you as you drove down the street. So I guess I should step back. So we did the one scenario where we were wiping the nails, but also we simulated removing the nails. And what we did here is having a glass bowl filled with a little bit of acetone, sitting in front of our nail technician, and it was just sitting there in a quiescent mode. It was just sitting there for, I think, about 10 minutes. We decided not to put one of the hands in it because the geometry, these are just way too large, and we thought it would mess things up. So we just had it sit there, and Mark sat there for 10 minutes while potentially being exposed. You can see over here, this is the photoionization detector that we were using. This is the dust monitor. This is another monitor that we took measurements, but we didn't use them because they weren't consistent with anything. And I guess I excuse myself for the rest of the mess in the background there. Okay, those were the capture efficiency for solvent and for dust. We also measured the each system's overall efficiency. And what this is, it's a measure that is used for air cleaners, like room air cleaners. And what it'll give you, excuse me, it'll give you a clean air delivery rate. How much clean air is it delivering into the room? And what this is a combination of the flow rate of the system, how many cubic feet per minute of air is it pulling through, and the efficiency of the filtration system, okay? And we decided to do this only for solvents, for acetone. So what we did is we placed each unit one at a time into what we call, well, it was an exposure chamber. And this is basically a glorified shower enclosure. You'll see it, a large shower enclosure. You'll see a picture of it in a sec. We added about 8 mLs of acetone to a glass pan, allowed it to evaporate and to come to an equilibrium concentration, mixing it around with fans inside. And then we turned on the ventilation system and watched, and we're measuring the concentration over time. And we watched to see how quickly that concentration decreased over time. And the rate of decrease over time, or the slope of that, I'll show you that later, is basically proportional to the flow rate of clean air, or the clean air delivery rate. Let's see. So this is what the system looked like, a schematic of it. So we have the local exhaust system here, a pan of acetone, a fan to mix things, another fan, and we had a probe hooked up to the photoionization detector here, where we're sampling away here. This is me dumping 8 mLs of acetone into the pan. Here's one of the fans. Oh, here's the fan. Here's another fan. And I think this is the hole in the wall where we're sampling, and here's the inlet for the local exhaust system. And so you can't, this is a glass walls here, so you can't really see it, but here's the door. Okay, now let's move on to results. Hold a sec. Okay, for the flow rate and face velocities, here's the different units here. And let me step back a sec. This morning I realized that we evaluated these 4 specific systems. And this is a little like consumer reports, that if you're going to buy, say, a washing machine, you go to consumer reports to see what are rated well. Well, typically what happens is you find something in the store, but it's not in consumer reports because they've changed models already. This may happen with these units as well, that they may be tweaking these models after we've done this. So you may not be able to find these exact systems out there. That's a warning, I guess. Okay, so the flow rates we measured, and we're using English units here because that's what generally they use, not in terms of the science, but in terms of the product literature. So we had a little bit of a range of flow rates. The air impurity system had about 78 cubic feet per minute, or CFM, up down to about 46, between 46 and 78. Not a huge range. But when we look at the face velocities, the range becomes much, much larger, between 200 feet per minute and about 1,900 feet per minute. The difference here is that the size of the inlets differs greatly. If you have a smaller inlet and you have the same amount of air going through it, the air is going to be flowing a lot faster. It's like pulling air through a nozzle. If you have a big inlet, the velocity is going to be much lower. And we'll see how that affects the capture velocities later. I guess later's now. When we measured the velocities, the capture velocities, we measured multiple distances, but I'm showing you just these two distances, 2 inches and 5 inches from the inlet. You can see that they're fairly high. We generally tend to shoot for maybe about 100 feet per minute as good capture velocity to capture contaminants. But it really depends on the exact configuration and how much cross drafts there are. But so you can see that at 2 inches we have very good capture. At 5 inches, probably closer to where the work would really be doing. I guess it depends on which finger they're working on exactly. But we seem to have pretty good capture velocity there. The Weller FT had a little low, but I think this probably is going to be adequate to do the job. And for each of the units, we came up with what we call a capture velocity profile. Because we're taking measurements every inch or so down the line, we're able to make this surface that estimates what the velocity was at different locations. And just to give you a sense of it, we have the inlet right here, right about here, and we're measuring, this is 0 distance from it, 1, 2, down to 10 inches, and this is center line, 1, 2 inches. You can see that the different colors, so the hotter colors have higher velocities. So this orange area here is about 600 to 700 feet per minute. Out to here is about 300 to 400 feet per minute. And this bluish area here, 100 to 200 feet per minute. And about here is, this is sort of a sweet spot right in here. Whoops, oh, that's interesting. Between 4 and 6 inches, we have good capture velocity. I'm not sure, but in some situations, having too high capture may not be a good thing. And I haven't spoken to a nail technician about it, but if you put on nail polish and you dry it too quickly, is that going to be a problem? Because having a lot of air drawing over the nails may cause them to dry too quickly, and that may cause problems with the finish. So we developed these profiles for all of the different units. Okay, when we looked at noise level, we put them in a quiet office and measured a baseline. The baseline level was about 54 decibels, dBA. And I should note that, typical conversations are about 60 decibels. So this is a quiet office. Not a lot of background noise. When we are concerned in terms of workplace noise exposures, we're talking about 85 decibels, okay? So it's much, much higher than what we've been measuring. When we turned the systems on to high, we found a pretty big variance in terms of the noise levels. The Weller FT was by far the quietest, and you could tell the difference. Much quieter than, say, the Healthy Air system. And the acceptability of these noise levels would really be dictated by the background noise in the salons. I'm assuming that some salons that have very, very quiet backgrounds and were really there for the ambiance may not find some of the louder ones acceptable, and it would be difficult to evaluate that. We did measure a couple of these systems on low, and actually the Weller FT, you could hardly hear that it was operating, but it was also only a trickle of air as well. So they were quite a bit lower noise levels when they're down low. And I'm not sure if the salons would use them on the low setting. Okay, now let's look at some exposure data. I'm going to explain this graph here because I use 4 of these graphs to explain our results. And these graphs are comparing the average or the dust measurements that we made. And we've got the different units here across the bottom, the 4 over here, and then NC again is no control. Now these boxes are showing the distribution of our measurements. the line in the middle is showing the median, or the 50th percentile concentration, or where half of the concentrations were above and below. The box is showing between 25th percentile and 75th percentile. And these are called whiskers. The top and the bottom are basically showing the, not necessarily the extremes, but 1.5. This one's about 1.5 times the 75th percentile, and this is about 1.5 times the 25th percentile. The numbers up top are telling you the 99th percentile data point. So that's telling you the extreme values. How high did it really get? And lastly, to make these graphs show good visually, we remove what we call the outliers from this, because you may have a couple measurements that are way up here. You can't really see that, but way up here. But we removed them because if you plotted them, everything would be squatted down, and you wouldn't be able to see much differences between this. So starting with the dust exposures, you can see that all of the systems were quite a bit different from the no control. So it's good. The systems really did reduce the dust exposures. It's good to see. Then when we removed, this is the same data as before, but we removed let me go back, we removed this one to allow these to expand graphically. And you can see, so we can compare the systems. There were some differences, but not huge differences between the units themselves. Some were better than others. And at the end, I'll show a comparison of all the units and their average capture efficiency. So these for dust. Now when we look at the acetone exposures, because we did the two experiments, you see the wiping nails and the acetone bowl, as we called it. Again, no control here, no control here. You can see that the no control was much, much higher. And again, these are 1 second averages. So they tend to be very bound. They tend to be very variable. So you can have very high exposures, but overall, on average, it's not going to be that high an exposure. So this one got up to 978. This got up to 2,000 parts per million with no controls. But again, they're quite a bit different from using the controls. Now, next slide, I'm going to remove these two no controls to compare the units. You can see that they are a little different. Again, but all four systems were fairly good at removing the solvents. So these exposures were only done, we would call these task exposures. So we wouldn't expect a nail technician's exposure to be at these levels averaged throughout the day, because they wouldn't be doing these activities continuously. They wouldn't be wiping nails 8 hours a day continuously, or sitting in front of a bowl of acetone 8 hours a day. They'd have other activities where they didn't have exposures. Now this next slide shows all of these data together, where I'm comparing the capture efficiencies for the different systems. So basically, overall, they all did a pretty good job of capturing the dust as well as solvents. But there are some interesting trends. So the Aller air system had fairly high capture efficiency for all different experiments, whereas the healthy air and the other two systems dropped off a little when looking at the wiping nails and the dust experiments. We don't exactly know why that happened, but it could be because if you think about the dynamics of the different experiments, wiping nails, you're sitting there wiping nails, moving your hand back and forth on top of the nail, and that moving your hand is generating cross-draft, or air moving back and forth, which would prevent efficient capture of those vapors into the system. With the dust, you're sitting there with a grinder, and that grinding is spitting off that dust in a direction that may not necessarily be aligned with going right into the nozzle. So when we have, I guess, systems that or processes that are causing the contaminants to depart from being sucked directly into the ventilation system, we have slightly lower capture efficiencies. But overall, I think it's fairly good to have between 77 or actually 67 and 98% capture efficiency. I was very pleased with these systems. Okay, now let's look at the clean air delivery rate. Here's two graphs. The first one, the top one, shows the actual concentration in the chamber. I'll step you through it. Here, it's sitting there without the acetone. I've opened the door here, dropped the acetone into the pan. It's evaporating slowly. Over time, it's going to come up to an equilibrium concentration up here and just going to sit there. The ventilation system is off. It's just a sealed large box at this point. Right here, I turn the ventilation system on. It starts sucking the air through the system, through the filter, and it's recirculating that clean air back into the system. So it's dropping off. It's basically pulling out the acetone from the air and dropping off in a way like this. It was great to see this shape of a curve because this is what we were making it into what we call a one box well-mixed model. And the data were great. So it was great to see, and it was great for a student to do this experiment. Now, if you do some fancy hand waving and take the logarithm of the data from here down to here, you can make it linear. And then you could do a regression onto it. And the slope of this curve is equal to the air exchanges, the equivalent air exchanges per second. Okay, so this was basically having a 0.0067 air changes per second. Now, if we multiply that times the volume of the chamber, we come up with basically a flow rate of clean air that's being delivered into that. And this next slide shows that for all the different units. We range between 57 and 127 cubic feet per minute of clean air delivered by each of these systems. It was interesting to compare this clean air delivery rate to the flow rates that we measured, okay? Because the CADR, the clean air delivery rate, is basically a combination of the airflow plus the efficiency of the charcoal filter. If there's no charcoal filter in place, it's not going to be providing, it's going to be zero because it's providing no clean air. If it's a perfect filter, it's going to be the same as the flow rate. There's going to be various errors involved, but basically the same. We found some interesting results, and it turned us back, and we investigated the system and actually found that some of these systems had some leaks in them that were allowing some of the solvents to get around the charcoal bed. We gave that information back to the manufacturer so they could improve the system. And it was probably fairly easy for them to do that. So it's quite interesting to do this. And then just going to wrap things up here. I think we've got good time here. In conclusion, I think the systems generally performed very well. I was very pleased by how they performed. Some were better than others. But there's a lot of different factors that go into the choice of a system, whether someone would want to choose the best, the most efficient system, but I don't know anything about the cost, or you'd have to measure the noise levels as well as some of the other specifics of it. We found reductions in dust between 70 and 90%, and acetone between 77 and 98%. Those are pretty good reductions in exposures. I should note that these were not done in a nail salon. Initially, we were going to be doing it. We tried one experiment, but it was somewhat of a disaster. Some people got locked into the building, and then some people got locked out of their car, blah, 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 at night. But regardless of those logistics, it was a lot easier to do these experiments in our lab. We would really, in order to figure out how effective these truly were in a realistic setting, we'd need to place these systems in nail salons and do specific experiments. There are going to be various use parameters. How did the nail technicians actually, we tried to replicate a lot of factors, but we may not have gotten everything perfect. And, that's likely that it would be slightly different in a true nail salon. obviously there'd be multiple sources as well, because likely that there's not just one table being used at one time. Another thing that we did not look at is the filter capacity. With particle filters, as the filter builds up dust on it, the filter actually becomes more efficient at removing particles. The filter gets more clogged and is able to remove more more particles. What happens, though, is that it strains the motor of the fan, so you get problems there. And when it's more obvious when to change the filters, but you may not necessarily know when to change the sorbent bed filter, okay, the activated charcoal filter. And when this gets filled up, when the sites on the activated charcoal get saturated, it's not going to be effective. And the solvents, or the acetone and whatnot, are just going to blow right through it. So it's going to be very ineffective. And I hope we weren't able to do it at the time, but we may be able to in the future evaluate the capacity of some of these charcoal beds. There may be some literature out there that shows potential capacity, but I think we may do some experiments to actually measure it. Our flow rates and our noise levels were comparable to what the manufacturers said. Actually, the flow rates were lower, much lower. And there's a reason for that. When the manufacturer measures their flow rate, they're measuring it at the fan itself, not with the filters in place, not with the nozzle in place, not with anything else in place. So if you're looking at the system and looking at comparing specifications, you need to make sure that you know what you're looking at. I've taken systems and measured the flow rate sequentially as I take parts off, and it increases as you get closer to the fan. And right in front of the fan, it seemed, for this one system, it was exactly what was specified in the manual. Noise level were comparable to what manufacturers said. For some of them, others it was a little higher. And noise is a little quirky because maybe if the system was jarred during shipping or things like that, or specific orientations, it could be slightly different. And lastly, before we start handling questions, is that these systems may not be up to code. And what I mean by that is that the International Mechanical Code was passed a few years ago that states that for new nail salons and for large remodels, thou shalt have X amount of ventilation to each table. And that ventilation should pull contaminants away and exhaust them outdoors. Okay? These systems are not designed to exhaust the contaminants outdoors. They're designed to filter them with the sorbent bed or with the filter and recirculate them. So they would not be up to this code. They can be used, per code in, shops that are operating, fine, that's not a problem. But if you're going to use these to try to come up to the new code, it may not be acceptable. I should say that the International Mechanical Code may or may not be accepted by your jurisdiction, so it really depends on whether they've adopted this change in code. Here in Washington, our county has, and I'm not sure if the entire state has, but it may be the case. And then lastly, I'd just like to acknowledge Mark Boudreau, who was our handy nail technician, and I would not recommend getting your nails done by him, but the rest of the field research consultation group helped a lot with the study. Local Hazardous Waste Management Program in King County, Washington. I thank them for funding the project. It was great working with Lori. We hope to work with her again. And then our Department of Environmental Occupational Health Sciences at the university also supported this study as well. Okay, now why don't we open it up to questions?
Great. So you know what I'm going to do? I'm going to unmute everybody.
Okay.
It looks like we already have a few questions in the chat box if you want to go ahead and
okay. I'll start
I'm going to unmute folks, and there's going to be a little pause.
Okay, so we're in the
conference
chat here.
Has been unmuted.
Okay. The first question is the label of independent contractor valid in the context of nail salon work or is it bogus? To my knowledge, I'm not an expert on the industry and how it's organized, but I understand that a lot of the nail technicians are independent contractors and basically lease tables. So it is, and is it bogus? I don't know. I don't know exactly how how an employee is defined. I know that for certain industries like construction, OSHA and other agencies have gone after some of these pseudo-independent contractors and have said, no, you're not an independent contractor, you're really an employee, and have nailed them and said, you can't do that. But I have not heard of them doing that in the nail salon, or it's the same as the hair care industry as well, but I've never heard them going after these companies, these individuals. I imagine for, if there's a chain where it may be a different relationship, it may be, they may go after them. Does that answer the question?
Not really. Oops.
So whoever said not really, how can I?
Oh, Marty, I'm sorry. This is Lori Foster. Yeah, sorry about that. There are, just to
You're
clarify,
not muted. What's that?
Yeah.
Yeah.
I realized I was no longer muted. Just sorry about that. I just want to point out that there are, in the case of nail salons, they may very well be some salons that say that they are independent and they're actually working for the nail tech or the nail salon owner. But it sounds to me like, because you've had experience with labor and industry, I don't want to put words in your mouth, you haven't actually seen them go after them.
I don't know. I'm not sure if they've gone after nail salons. And I think it may be difficult because it's so diffuse industry sector. So
well, and in our state, a couple of years ago, they actually asked me and some other people to go in and salons. The Department of is it labor? It would be Department of Labor, I guess.
Yeah, the DOL.
Department of Labor. And
DOL would do that.
Yeah, and I felt like it was kind of a conflict for us because if we started talking to nail salons about that, we could no longer talk to them about their health. But they did something for about 8 months. They tried to contact some nail salons and find out if there's a problem with them being independent contractors because they owed some money in back pay.
Okay.
So anyway, so it happened. So
yeah, so it is a potential issue, and it does shield the workers somewhat away from as not only OSHA but also workers' compensation coverage. At least in Washington State, if you're a sole proprietor, you don't have to have workers' compensation coverage. If you're an employee, your employer is required to have workers' compensation coverage for you. So, there are other protections as well. Okay, next question. Could you talk a little more about why you chose only acetone and dust? What was the reasoning for not looking into liquid monomer used for acrylic nails? Well, we looked at acetone and dust as surrogates, for acetone as a surrogate for a volatile chemical, liquid chemical, and dust, it was just a generic dust. The reason why we chose these two is because we have good measurement methods that will allow us to look at it in real time, so we didn't have to have a sample for each thing, because we're looking at very short task durations, and we want to ensure that we're able to measure it in real time. So some of it was technical, and some of it was sort of using it as a surrogate. So I believe that the liquid monomers are much less volatile than acetone, but obviously much more toxic, so you'd have lower exposures. But I believe that if they're being used in a similar manner, obviously you wouldn't have a pool of liquid monomer sitting there in front of the worker, but you'd be applying it similar to wiping the nails. You'd probably have similar capture efficiency for those materials. I can't speak for how well it is captured by the charcoal bed, though. I'm not sure. How do you think these results might compare with measurements from downdraft tables? You're welcome. I am not sure. With a downdraft table, actually, let me go back. we have a slide that shows a downdraft table. We actually used a downdraft table for the experiment, but we didn't have the system working. And what a downdraft table is it has a, can you guys see this? Someone say yes. Okay. It has a grill on the table, and you're pulling the air down through it. We didn't use this. We just used it as a table. And we'd have to do similar experiments to see how well it would work. This specific table was really, really cheaply made, and it had a really cheap blower behind it. So, and I'm not even sure if it had a charcoal bed in it. So it depends how well it's been designed. So it could, in theory, it could be pretty effective, especially if you have the hands right over it. So that's an issue there. Okay. Any other questions? You can ask them verbally too, I guess.
Hi, this is Anya from Department of Environment in San Francisco. Thank you so much for this presentation. I was wondering if you guys had any experience with the ventilation units that are used in salons to just purify the air throughout the salon.
Well, we've not done experiments with those, but those are the systems that would be ideally used for those clean air delivery rate measurements that we took. That's specifically, the CADR was designed for a system like that. How much air is being brought into it, and how effective is the charcoal bed or whatever bed for removal. And specifically for those systems, they need to be able to pull a fair amount of air through it to handle the size of the room in which you're using them. So they're rated for different size rooms, as well as the capacity of the bed, charcoal bed or whatever filter you have in there. So they may be effective at reducing stuff. It's not really going to be effective for reducing the workers' exposure from the direct emissions from the work that they're doing, because it's off to the side somewhere. But it's going to pull down the general room air concentration of potentially dust and solvent. So they can be effective, but they have similar issues with the appropriateness for the size of the room. Obviously, a bigger unit that has a larger fan would be better for a larger room. But you also need to ensure that the charcoal bed or whatever has enough capacity and is changed frequently enough. And that's the thing. Changing these charcoal beds can be a pain. Some of them you have loose activated charcoal, so you've got these granules of dusty charcoal, that you have to pour in, and others you just replace the whole thing. But the filters can be expensive, so people may not be all that willing to pay for them.
Thank you.
Sure. Anything else? Okay.
Any other questions?
I guess I didn't have my email address if people have questions, but it's mcohen, M-C-O-H-E-N, at u.washington.edu. M-C-O-H-E-N at u.washington.edu. So if you have any other questions, just drop me a line. I'll try to answer you.
Great, and I can send out that email to the folks who are RSVP too, in case they have any questions.
Okay.
Any follow-up questions for you. Well, thank you so much for taking the time to present on your findings. It was really interesting and hopefully informative for the folks who participated.
Yeah, I hope so.
And we did record it, so
Marty,
we can talk about whether we can distribute that recording or not. But if there's no further questions, we'll go ahead and end the webinar. So thank you so much for participating.
Okay, thanks everyone.
Thanks.